Hi everyone, welcome back to yet another episode of ARA Anxiety Recovery with Albright. If you're new here or you're seeing me for the first time, my name is Medley Albright, and Albright is an ex-anxiety sufferer who uses her own experience of suffering and recovery to help others who are still struggling. So whether you are struggling with panic disorders, agoraphobia, OCD, depression, social anxiety, health anxiety, generalized anxiety disorder, any type of anxiety disorder, you are in the right place. If you have not yet subscribed yet, I would urge you to subscribe because it helps the channel grow. Otherwise, in this video I want to talk about high level keys to anxiety recovery. There are basic levels to, basic keys to anxiety recovery, something like, acceptance, allowing without adding second fears, exposing yourself to your fears, living your life. Those are basic things. If you have been here for some time, you know that those are basic keys to anxiety recovery. But in this particular video, I want to talk about high level keys to anxiety recovery. Maybe you are at the nearly recovered stage, but you're still stuck. I want to share with you some of these, high level keys to anxiety recovery that I also share with members of my program. There is knowledge about anxiety, which many anxiety sufferers have gathered knowledge. You have watched TikTok videos, you have watched Instagram reels. That is gathering information about anxiety, which I know most anxiety sufferers have done that. They have the knowledge about anxiety. And also make sure not to overwhelm yourself with information. This person is saying this person is saying this person is saying this. Now you're confused. And also you have all this information and you're not applying. There is also that part. You have all this information, but you're not applying. You are just an information gatherer. That one is not good. It will keep you stuck. So there is a gathering information about anxiety, and also there is guidance out of the anxiety cycle. Maybe you are at this almost recovered stage, you are at the nearly recovered stage, but you're still stuck. So that's what I do. That's why I come in. That's why the coaching program comes in. You are almost, all these symptoms are gone, but you're still stuck. You still feel anxious. You are almost there, but you are not there yet. So if you are that kind of person and you want me to understand your specific situation and guide you out of the anxiety cycle, you want to overcome this anxiety thing permanently, use this WhatsApp or this email to reach out to me. Otherwise, let's get into the video. So some of the high level keys of anxiety recovery that I learned when I was recovering from anxiety, some that I can remember. If I remember some, I'll just create another YouTube video about them. But right now, I'm going to share 5 high level keys to anxiety recovery. So the first key to anxiety recovery, the first high level key to anxiety recovery is realizing that recovery is about unlearning certain fears. With anxiety recovery, there are 2 types of fears. There is the first fear, the first flash of adrenaline that causes the panic attacks, that causes the intrusive thoughts, the feelings of unreality, the feelings of dread, the impending doom, name them. That's the first fear. You have no control over it. They are simply symptoms of a tired mind. They are symptoms of a sensitized nervous system. They are symptoms of an overactive mind. You can't control that. In fact, the more you try to control the panic attacks, the more you try to suppress them, the more you try to make them stop, the more they come, because that anxious energy has nowhere to go. It has to be released in form of those panic attacks, in form of those heart palpitations. So that anxious energy is gonna stay within. So the more you fight with the first fears, the more they will come up. So the second fears is what you have control over. What are these second fears? Second fears are you resisting anxiety, fighting anxiety, solving anxiety, trying to make them go away, sitting at exits. Anytime you are at the mall, you are at the supermarket, you just want to be at the exit just in case, walking with medication just in case, checking your body for symptoms. Those are the second fears that I'm talking about. That's what you need to unlearn. Some second fears also, like something like checking your blood pressure, checking your heart rate, checking your pulse. Anytime you do those things, anytime you check, you are proving to your brain that really there is a threat, that the high heart rate is a threat, and therefore more adrenaline. You worry, you stress more, and anxiety ramps up. When anxiety ramps up, you experience this same heart palpitations, your BP goes high, you experience these same symptoms that you're trying to run away from. So you need to unlearn these fears. You need to unlearn not always adding second fears, not trying to figure out things. You're having this thought that maybe it's a heart attack. Now you try to figure out, I have Googled, I have checked, I have done all these things. It's not always a heart attack. You go to Google, you start searching, does anxiety cause a heart attack? Solving those thoughts keeps you stuck with anxiety. Trying to figure them out, trying to resist those physical symptoms symptoms trying to fight anxiety. That's what we call second fear. Second fear is anything you do to try and find relief from anxiety, to try and, solve anxiety. That's what we call the second fears. I want you to comment down below some of the second fears that you always perform, whether it's working with medication just in case, whether it's sitting at the exits just in case, whether it's checking your heart rate every time, checking your pulse, checking your BP. Those are the fears that you need to unlearn. And you are not unique that you are performing these second fears, because anxiety is scary. Those symptoms are not fun to be with. So when you're experiencing the high heart rate, you just want to make sure that everything is fine. When your BP goes high, you just want to make sure that everything is fine. When you are in, when you are in the supermarket may be making you anxious and you're just afraid something might happen. So you, as a human being, as a normal human being, because your brain wants to protect you, the catastrophic thought that your brain is gonna release is, run away, resist this thing, fight this thing so that you can feel better. But because you didn't know better, because you found my channel, because I'm here, I'm telling you that these second fears, the thing that you're doing to try and find relief from anxiety, that's what is keeping you stuck, because you're proving to your brain that indeed there is fear around, there is danger, that those physical symptoms are a threat. And when when your brain realizes that there's a threat around, more adrenaline, more stress hormones, and more of the symptoms that you're trying to run away from. So recovery is about unlearning certain fears, unlearn those fears. And that's part of what we do in the coaching program. If you want to unlearn the second fears, if you can't just stop worrying, you can't just stop overthinking. I talk about worrying, I talk about overthinking, but you can't just stop thinking. That's what we do in the program. If you need help with that, if you need help to, just calm your mind, if you need help with dropping the second fears, then use this WhatsApp or this email to reach out to me. The second high level key to anxiety recovery is that the sensitized brain is almost never right. The sensitized brain is almost never right. You can't think straight when you are sensitized. You can't make logical decisions. In fact, logic is thrown out of the window when you're struggling with anxiety, because at that time, the amygdala, which is the brain's fear center, has taken over the prefrontal cortex part of the brain, which is responsible for, making logical decisions, which is responsible for rational thinking. The amygdala has taken the driver's seat, so you can't make logical decisions, you can't think clearly. So the sensitized brain is almost never right. It's telling you you're going to have a heart attack. You go to the hospital, everything is being done, all tests are being done, your heart is normal. That's why I always tell you, do not believe the what if thoughts. The what if, the brain comes up with the what if catastrophic thoughts. Never believe those thoughts. As long as you have been to a professional, you have been to the hospital, everything has been cleared out, ECG, echo has been done, you have been scanned, your body and head, you are okay. The doctors know their job, you are very okay. The sensitized brain has never been right. A normal nervous system, for someone who is not anxious, someone out there who is just living their life, it takes a significant amount of stress to trigger adrenaline release. But for someone who is sensitized, anything, the brain treats everything as a trigger. That's why everything makes you anxious. That's why you want to avoid everything. A sensitized nervous system is overreactive and has a low tolerance to stress. That's why everything makes you anxious. That's why you want to avoid everything. The sensitized brain that does not care about anything else. It does not care about pleasure. It does not care about making you happy. It cares about safety. That's why that brain comes up with the what if catastrophic thought, so that you can either flee or fight that threat. If you have been reacting with panic the way you have always been, if you have been reacting with fear, you have proven to the brain that really the threat is real, and therefore more anxiety. So you need to realize that the sensitized brain is not always saying the truth. It is almost never right, because a sensitized brain makes decisions on emotions. It doesn't care about logic. I've told you, logic is thrown out of the window. It is just emotional. Like, it's either this or this. It's either life or death. If I don't do this, I'm gonna die from this. If I don't do this, I'm gonna have a heart attack from this. If I don't do this, I'm never going to recover. It's always the worst case scenario. So the third high level key to anxiety recovery is realizing that recovery is not a quick linear process. And that's where most anxiety sufferers stay stuck, because you have tried everything. I tried breathing techniques, I tried meditation, I tried yoga, I tried talk therapy, I tried supplements, I tried all of these things, but nothing ever worked. This is because I was looking for a quick relief, and it is not my fault. Growing up, we were told that if you didn't feel good, if you didn't feel okay, you go to the hospital, you look for something that can help you feel okay. You go to the hospital, you find, you take pills and you're okay. If you feel, you are even never allowed to feel sad. If you feel sad, you're told to, you need to feel good, you never need to feel sad. So when struggling with anxiety, you always need a quick relief. And that's something that is going to keep you stuck, because looking for quick fixes, first of all, when you are doing the breathing techniques, that's to feel relief from anxiety. When you're doing this, when you're snapping a rubber band on your wrist, you are proving to the brain that anxiety is not something to be felt, and anxiety is something to run away from. You are not supposed to feel anxiety, and when you prove to your brain this, more anxiety. The second thing is that it adds pressure to your already sensitized nerves. When you're trying this, it doesn't work. You're changing these medications, it doesn't work. You're changing these supplements, it doesn't work. You get disappointed. You add pressure to your already sensitized nerves, so your nerves don't get time to calm down. They don't get enough space to desensitize, so therefore that keeps you stuck in the anxiety cycle. Also, those techniques, they create frustration. If this doesn't work, you get onto this, you get onto this, you get onto this, so you're frustrated because you're like, okay, I'm trying almost everything, nothing is working. And that's one of the reasons that led me to depression, because I was now stuck in this state. I have tried everything, nothing is working. So it's one of the reasons that led me to depression. So quick fixes don't work. Stop looking for quick fixes. You will waste a lot of money. People will call you around because now you are looking for this, it's not working. When someone says try magnesium, it won't work. Try this, it won't work. If there was a magic pill, we wouldn't be in this conversation. If there was a magic pill, doctors would have known about it and you would have taken that pill and recovered from anxiety. There is no switch. Looking for quick fixes won't help you with anxiety. Recovery is about changing your beliefs, changing your behaviors, changing your thought patterns. It's about mindset, it's about attitude, and it is gonna take time. Anxiety recovery taught me patience. I'm a very patient person, by the way. It taught me patience, because if you don't learn patience, then I don't know, it's gonna take time. You have been in the cycle for months, you have been in the cycle for years. So we are trying to develop new neural pathways, and this is gonna take time. Retraining your mind to develop new behaviors, it's gonna take time. So there is no quick fix. It is not a linear process. It's an up and down affair. It's like learning a new language. It's like learning a new skill. You can wake up one day and sometimes you find that, okay, you are not as perfect as you thought. And does that mean you have lost what you knew in the drain? No, it just means that, okay, there are some areas that you need to improve. There are some areas that you have not learned as well. So recovery is an up and down affair. That's why you experience tough days. Your brain just wants to test you if you are still afraid. So you're gonna experience tough days when struggling with anxiety. It is not quick. It's gonna teach you patience. It takes perseverance. It takes persistence. It takes learning. It takes dedication. It takes all of those things. So be wary of someone who is promising you a quick fix, because it's not available. The fourth high-level key to anxiety recovery is seeing setbacks as opportunities to grow. Because that's what they are. Setbacks mean you are doing great and moving forward. At first, when I still didn't understand, setbacks, I thought that they meant that I was a failure. I thought that they meant that, all the progress has been washed down the drain. But that's not what a setback is. Setbacks are opportunities to heal. They are opportunities to show your brain that you are safe, and it should stop sending you those alarms. For those who don't understand setbacks are when you have been doing well, you have gained knowledge about anxiety, you started practicing, you have been doing well for 3 months, then all of a sudden one day, boom, you are having these physical symptoms that you thought you had overcome. You are having these intrusive thoughts, these feelings of unreality, this panic. Then you ask yourself, okay, I thought I had been doing well, now what is it? Setbacks are very normal, and they can last as long as they can. I get that question a lot, like, how long does setbacks? They can last months, they can last they can last weeks. It just doesn't matter. When you just not focus on them and live your life, setbacks are just like the heart palpitations. They just go away on their own. But when you focus that now you stop living, stop practicing the principles of anxiety recovery, because you feel like now you are a failure, you are not doing as well as you thought, you will keep yourself stuck. Setbacks are very normal. I faced countless setbacks. I stopped even counting, because people are saying, you have 2 setbacks, 3. I had more. I had a lot and long setbacks. So setbacks are opportunities to grow. The brain learns when anxiety is turned on. You can't say that, I'm gonna practice the keys to anxiety recovery when I'm calm. Why do you need to practice the keys to anxiety recovery when you're calm? Like, it just doesn't make sense. So the best time to show your brain that you're safe is when you are experiencing setbacks. To me, I just saw setbacks like, I still have anxious energy within. I'm still not recovered yet. I still have anxious energy within that needs to be released. I never saw myself as a failure, because once I had been reassured that setbacks are, very normal, everyone experiences setbacks, and they were able to go away sooner than I thought. So see setbacks as opportunities to grow. The 5th high-level key to anxiety recovery is accepting responsibility. You need to realize that you always have a choice. You always have a choice to either respond or to remain internally focused. You always have a choice. You have the power to choose. What is your contribution to your own suffering? You know, you have to be honest with yourself. You can't say, I want to get to that healing stage, I want to recover, but you're still doing the behaviors that are keeping you stuck with anxiety. You have the choice to either, you know, remain in your cocoon or to go outside and start living your life. You know, you always have a choice. So I chose to get my life back from anxiety. Someone else might choose that they can only manage or cope with anxiety. We always have a choice. So what is your role in your own suffering? What is your role? Accept the responsibility. It's either you remain like that or you choose to get your life back from anxiety. Which side are you? Managing or coping, or choosing to get your life back from anxiety? And recovery from anxiety is difficult. It is difficult, and I think I'm gonna make another video on why recovery from anxiety is difficult. Recovery from anxiety, it forces you to do the things that you don't want. It forces you to face your fears head on. It forces you to expose yourself to your fears, to live your life even if you don't feel like it, to face whatever is happening inside even when they are so much scary. And that's what a lot of anxiety sufferers are not willing to do. They are not willing to, you know, face their fears. They are not willing to live their life regardless of how they feel. So recovery can be difficult to some other people, but me, I had to choose my heart. I had to choose either living my life with panic for the rest of my life, which I just couldn't. I'm a free spirit. I love life. I love going outside and laughing without having to think about something else that is bothering me, without having to think about anxiety. So I had to choose my heart, either staying the same for the rest of my life or choosing to get my life back from anxiety, choosing to expose myself to your fears, accepting responsibility, choosing to go outside there however I felt, facing my fears, to have the power to either react or respond, the power to choose, like, do I need to internally focus, you know, on myself, or choosing to engage in real things in real life. Take responsibility of both your symptoms and your purpose in life. If you have watched up to this point, a thumbs up for this video, like this video, share this video to other people who may need it, and subscribe if you haven't yet, because it helps the channel grow. Otherwise, let's meet on the next video.